Hello, my name is Faith East, and this is my toileting and enema video. So I would perform hand hygiene, knock on the patient's door. Hello, my name is Faith. I will be your nurse today. I'm a student nurse at CL. My assistant would be providing some privacy. I would check name and date of birth and make sure that that is correct on the wristband. Then I'm going to explain that we're going to be doing an enema today. Have you ever had an enema done before? Okay, they have, so they kind of know the procedure. If not, I would explain it to them more on what we're going to be doing. When I come in, I want to make sure that I have all my supplies. This would normally be on the bedside station, so I have this. I have a ready-to-use enema, which is already pre-filled, and the tube is already 3 to 4 inches, and it's already pre-lubricated, so we don't need to do any of that. It's already ready to go. So I'm going to put the bed up in the highest position, or a good working position for me. And then I'm going to explain that we're going to shift the patient towards me and then put them on the left side with their right knee slightly bent. And my assistant is going to help pull that patient. So this is a good working height for me. So I'm going to stop right there. Normally we would have a draw sheet to help us move the patient, but we don't have that currently. So I would put down my handrail, leave that one up because the patient would hold onto that side rail. So we're going to put him towards me on a count of 3, and then turn him towards me. And we'd make sure, that the right knee is slightly bent. So my partner will be making sure that he stays on his side. He would also have a blanket on him to provide for privacy, so I would just drape that right here and only uncover the part that I will be working with. So before I touch the patient for any perineal care or near that area, I'm going to put on my gloves. Okay. Alright, and like I said earlier, this is already ready to use and it's pre-lubricated, so I'm just going to take it out of the box. I'm going to uncap the cap, and this is ready to go, so I'm just going to find the anus, ask the patient to just take a deep breath, and then I will insert it 3 to 4 inches. Since this is not an IV bag, I will be able to push, and I would push all this fluid into the patient, and I would tell the patient that their abdomen is going to be filling full, and when they feel like they can't hold anymore, or I've done the prescribed amount, I will remove it. Get a discard, and then we're going to put the patient back into a comfortable position on the supine position. So we're just going to lay him back on his back. 1, 2, 3. Alright. Make sure that they're comfortable and in the middle of the bed. Then I'm going to let my patient know whenever they can't hold it, whenever it's been the amount of time that they should retain the enema, they're going to push their call light. So I put the call light in reach and tell them that as soon as they push the call light, I will be right in to help them. So I would do hand hygiene, get new gloves, and then we're going to, he pushes call light, so we're going to put the bedpan under him. If it was a larger patient, I would lube this area with a spray lube, just so for easier insertion under the patient. So my assistant is going to help me lift up the hips, and if the patient can just spread his legs, I'm going to place it under with the flat side under him. Make sure that the anus and the genitalia are over the opening so that it is not going over the bed. And then I'm going to lift this patient's head of bed into a normal position for toilet relieving. It would be a normal natural position for him. And so as I'm raising the bed, I would explain that whenever they have gone, whenever they feel like they're empty, just push the call light again and we'll help clean them up and take a look at the items within the bedpan. And the patient can only stay on the bedpan for a max of 15 minutes. So I have to make a note of that when I put the bedpan under the patient, and in 15 minutes come and check and remove the bedpan at 15 minutes. So it's been 15 minutes, or the patient has done their call light, and so I'm back, and we're going to put the head of the bed back down so that we can remove the bedpan.
Give you clears.
All right. And then my assistant is going to help me lift the hips up and spread the legs while I carefully pull out the bedpan. Make sure not to spill it over the bed or the contents, or to put it back onto the patient. I would assess the bowel movement or all the fluids and things that are in here. I would assess it for any abnormalities, color, smell, the consistency of it, and then I would document what I've seen and then flush it in the toilet, clean this, make sure it's good and clean and dry, and put it back on my bedside station. Make sure that my patient has been cleaned up and that they are sanitary and back with their blankets and their gown, covering for privacy and warmth. And that they're comfortable. I would remove my gloves, perform hand hygiene, and make sure that the bed is in lowest lock position, that the call light is in reach, and then tell the patient that if they feel like they have any more to release or that they need anything else, to push their call light, and then I'll be back in to assist them. Then I would clean up all my supplies. My name is Faith East, and this is my toileting and enema video.